Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Acute manic episode, and we are focusing on the treatment aspect. So there is no single drug of choice for the treatment of the acute mania. So there is no DOC for the treatment of the acute mania. So if a patient is on antidepressants, so if he is on antidepressants, so first thing to do will be to stop it, to stop the antidepressant. And the next will be in case the patient is already on acute mania medication. So if you're considering the patient to be on the anti-maniac medication, so anti-mania medication. So if he is on anti-mania medication, that is if already on lithium or valproate. So if he is on lithium or the valproate. So lithium or valproate, you increase the dose of lithium and valproate and consider adding the antipsychotic. So you can increase the dose. So dose is increased and you try adding antipsychotic. So you also try adding the antipsychotic. You add. Next is you consider adding the short-term benzodiazepines for all patients. So you also add the benzodiazepines BZD for all the patients. So in case the patient is not on antipsychotics or anti-maniac medication. So not on the anti-maniac medication. So in case they are not on anti-maniac medication, they consider an antipsychotic if patients are severe and the behavior is disturbed. So this is to consider an antipsychotic. So you consider an antipsychotic. So you consider an antipsychotic if the symptoms are severe. So in case the symptoms are severe, you consider antipsychotic if the symptoms are severe. The symptoms are severe and the behavior is disturbed. So the behavior is disturbed. So you consider valproate, but next is you consider valproate, but avoid in women of reproductive age. So then you consider valproate, but you avoid in terms of the reproductive age women. The next will be to consider the lithium. So you go for lithium. You consider lithium if future adherence is likely. So in case of adherence, the future adherence is likely, you go for the lithium. Next is you consider adding short-term benzodiazepines, and this is short-term benzodiazepine, and this will be for all patients, To learn and grow daily like this, please do subscribe.